So Denise, you're completely right. This is the first time I'm giving this presentation in the name of my minister, obviously, and this has actually been prepared for a promotional campaign that we're launching in San Francisco next week. And so I have the honor of testing the presentation, and so feel free to point out the bugs because we have a week to improve it and make it work for the actual launch in San Francisco next week. Okay, this is my minister's slogan, I would say. We care to change, but we do not change because change in itself is good. Sometimes it is, often it is, but because we believe that these changes that we are fostering are going to enable us to produce better care. So, there's tremendous innovations coming on our way, and we've seen many examples these past 2 days. And they actually induce policymakers not only to rethink our healthcare systems, but also to design an ecosystem in our countries and in our institutional frameworks that actually stimulate those technological changes, a framework, an ecosystem where technology can thrive. And so this is maybe another perspective from the past couple of speeches, but I'm going to try to show what we as policymakers try to do to foster that innovation, to have that technology come to the patients, and how this will also benefit, I guess, entrepreneurs that can handily play on these opportunities. We're in France, so allow me to be a little bit chauvinistic today. And so before I start telling you what we are about to do, I'll try to give you a glimpse of what Belgium has been doing in the past 200 years, and try to show you how we want to be ahead of the game of the fourth industrial or digital revolution. So this is a very, very old train. I think it's one of the very first trains ever designed, and you may or may not know that Belgium was the first country in Europe to have a commercial train line. So just to show you, even during the first industrial revolution, Belgium tried to be at the forefront of the revolutions that are shaping our economy and society. During the second industrial revolution, there was a Belgian entrepreneur called Solvay. He's still, the chemistry company Solvay still exists. Hosted these very interesting, I guess, events every year in the Solvay Library in Brussels. This is where, and you see all these eminent scientists who gather there. And actually, on this picture, there's 9 future Nobel Prize winners. You can see Marie Curie, you see Wien, you see Lawrence, you see Planck, Albert Einstein, of course, and a couple of others. This is the second industrial revolution. This is 1911 in Brussels. During the third industrial revolution, so just after the Second World War, again, Belgium was at the very forefront of these changes, and it symbolized, or it crystallized during the World Expo in 1958, where we augmented, or how do you say, made a very big copy of the cell unit of an iron crystal. And this is the atomium in Brussels, which is an exact copy of that, but of course enlarged a couple of billion times. So today we're on the, we're in the digital revolution today, and for health especially, we see things happening very quickly. And as you can see in this slide, health tech is basically the third biggest sector array that is fostering that change. So what are we going to do about it? A little too fast. So what are we going to do about it? Well, we've come up with 2 basically strategic plans. The first one is Digital Belgium as such. So it's a generic plan to foster or to encourage digital change in Belgium. And the second one is more specific, focused on healthcare. So the first thing we did, and this is a quite recent decision, is that there's a new tax rebate system giving a rebate of 45% for seed money and business angels and VCs who invest in startups. So the initial investment, you can deduct 45% of the taxes. And this is, I think, one very big step to foster again a digital ecosystem. The second one is more specific, focused on healthcare. So the first one is Digital Belgium as such. So it's a generic plan to foster or to encourage digital change in Belgium. And the second one is more specific, focused on healthcare. The second one, and this is also very, very recent, is a new legislation for the peer-to-peer economy. And what we did is basically the first 5,000 euros that, for example, an Uber taxi driver will earn, he will only or she will only pay 10% taxes on it and will not have to fill in one single piece of paper. Everything is being done at the source, and so we are concluding deals with Uber, Airbnb, and whatnot, so that we can have that deal. So it's a very simple, no red tape for the people sort of measure. Very low taxes, 10%, and we hope that this will also again spur the digital revolution. Finally, also very recent legislation. It's not a scoop, but it's as close as it gets. Is data will become open by default. So instead of having an opt-in system where you may put data freely accessible, the opposite is going to happen. Every data will be freely accessible and open unless you ask otherwise. So three important changes, three important reforms to shape that digital ecosystem in Belgium. But what about health? What are we doing specifically about health? And this is the most interesting part, I guess. So we have a couple of great examples in Belgium. I'm not sure this is the website. I'm not going to play the movie, just an example to show you that IMAC, which is a spin-off, used to be a spin-off of KU Leuven, which is the biggest university in Belgium. Now it's the second biggest digital platform in the world, and they've developed a spin-off company, which is called MyLabs, which partners with Johns Hopkins University Hospital, in Baltimore, and they've designed a blood testing system. You may have heard of Theranos. This is the competitor. Theranos is in some problems, as you may know. MyLab, not yet, or not. And so this is really a tremendous innovation that may completely revolutionize and put the clinical biology industry upside down. And as you know, that's a very, very big expense of our healthcare system, clinical biology. Second example is Cubigo, which is a platform who basically connects elderly people and empowers them through all kinds of tools and communication systems. And they were elected one of the top 15 innovators or startups by Google last year. So it's a big, very promising company that maybe going to change the way we look to elderly care. So we have these tremendous innovators, and they're competing on a very high level worldwide. What can we do as governments to make more of these, or make sure that we have more of these in the future? Well, the first thing is we're going to start with a call in July for sandbox projects. And so, it's not the health industry's responsibility to make sure that innovators like yourself, entrepreneurs like yourself, get money for investments and growth and whatnot. But once you have a workable application, we need to test whether it can work in our healthcare system, right? In our reimbursement system. And so we freed up, and this is a little scoop for you, Denise, we freed up 3 billion euros to allow these applications, mobile health applications, mobile diagnostic applications and whatnot, to be tested in a real environment and earmark a little bit of money from the health insurer to see whether these applications actually have a value added for the patients. And so we're gathering, we'll start the goal will be launched in July, as I said. It will continue till September, and we do the selection as of October, and we hope to start the projects the pilot projects, the sandbox projects in January. This will allow us to again have the data to see what works not. Efficiency gains for the reimbursement system, also better quality for patients, and whatnot. So first, big important measure. Second one in the same field is, of course, we'll have to adapt the legislation, because in many countries, telemedicine is still in a gray zone, legislative gray zone. So we'll have to change the legislation third important aspect is patient authentication. Also very complex, of course, especially with mobile devices. You want it to be super secure, but you also don't want to increase the barrier too high, otherwise nobody is going to use those applications, obviously. So we're designing a system as well to give us maximum security and minimum barrier to entry. Yeah, so that's the next of the order. Second big innovation that we're going to introduce is we're going to have a single point of entry for digital health in Belgium. It's going to be based on the very center of Brussels and quite, I guess, charismatic location. And what it's going to be, it's going to combine both a platform for startups where they have, subsidized place for innovation and office space, etc. But on that same platform, a small organization, startup-like, will be giving them advice on who to contact for what information and giving them access to all the people that they need to get access to make this application into something that is actually going to have a proper place in the reimbursement system. So we're going to combine the business side with the policy side on one platform in the very center of Brussels, with all the information centralized and consolidated in one single place. So this is the slide for the sandbox project I talked about. The third important measure we're taking is so we've had the open data strategy, open data by default. We have a big data strategy as well. This is going to be presented at the end of this year. I cannot say too much about it. Maybe this is for next year, Denise. But the point is to have a big data strategy to empower startups and all the digital health applications. And finally, of course, these are all push factors, right? Top down, we give incentives, we create an environment where we cut red tape, where we give fiscal incentives and whatnot. But there should also be a pull factor. And I have not talked about this sufficiently, I think. But the pull factor obviously are the patients. If the patients think that the information and the applications that they're using is beneficial, obviously those applications are going to take off. But in order to have that pull factor, I think the government also has a role to play in sort of structuring that information without intervening in the information that is coming to the patient. And so the last thing that we're doing, and this is more of a long-term project because it's quite complex, we're building a platform to have a patient record where all the medical records of the patients can be centralized, but also integrated in existing communication devices between patients of the same who suffer from the same condition, empowering tools, etc., etc. So once we have all these great innovations that you guys are building, we need to integrate them into one single point of access, where the patient has easy access to from any device, anywhere they go. So this is the last thing, and we want to sort of start rolling out this application as soon as 2018. We're still on schedule, and this is, I think, the biggest and most important pull factor to really show the patients, show the people, show the citizens how important this information can be for them and how it's going to empower them in managing their own health. I thank you.
So much. May I ask a couple of questions? Yeah. So, as you've seen through the tweets, because I know you weren't here the whole time, digital health is a lot about starting things and then evolving as you go. So now it's taken quite some time to make this, well, not so long, but it's taken a few months to make this plan. And what happens when you start, and it's natural that there would be hiccups in it. What will be the method for adjusting this plan as you go? And will it be you, or is there another Miss or Mr. eHealth?
Well, I'm not Mr. E or mHealth. We have a team for that, obviously.
It's a team?
Yes, it's a team. I'm the deputy chief of staff, so I'm here consolidating their information and their hard work. But obviously, we're not working as a government, Deus ex machina alone. We have a big sort of a steering group, a steering committee who's helping us in taking or in making those strategic choices and Gerard is here in the room, and he's been invited a couple of times to come to the cabinet and to discuss these things. So we do it obviously with the employers associations, with the entrepreneurs, with the tech people, with the data crunchers, etc.
Okay. Does anybody have a question? Just shout it out. Yes?
Would you encourage young entrepreneurs to come to Belgium? They are in the medtech industry.
Absolutely, yes.
Say that again? What was the question?
The question was whether I would advise tech entrepreneurs to come to Belgium.
From France?
From anywhere. Yes, that's the purpose, and this is also why we're starting this roadshow in Paris first as a test case.
Do you expect to get them to come from America to Belgium?
What we'd like to do is, many Belgian entrepreneurs, and Gerard is one of them, they have offices in Belgium, but the bigger office, I guess, is in San Francisco or New York or London. What we want to say is, and I think the MyLab example is a good one, is like, we have the brains to compete with the top people in the world. So why do you invest in San Francisco when we can offer you more or less the same conditions in Antwerp, Ghent, Brussels, and the whole cluster? Of course, Paris is 1 hour away from Brussels. Amsterdam is 2 hours away. London is 2 hours away. We're one big cluster as such.
And 300 varieties of beer and French fries, right?
Yes. For making good deals during lunch, that's a very helping factor. But my point is, I think you're being too modest, and if you see the public and private, I was talking with somebody during the break, saying like, if you see the public and private investments in the US, it's going, it's skyrocketing, and in Europe, it's because we're so risk averse, it's still very modest. What we try to do with this plan and the different incentives, both fiscal and data, is to say, look, we can shape this environment in Europe as well that is interesting for entrepreneurs, actually more interesting for you to invest here instead of in the US.
So anyway, I find extremely refreshing all of the preparation that we had together. It's been very easy to speak with you and work with you, and the people in the room know that I'm saying this in reference to other places where it might be less so. So the fact that you got my joke is... So thank you very much, Brieuc, and I do hope we'll see you next year, if not before.
I'd love to.
Okay, thank you. So would Fabrice Angelini and Didier Menissier come here, please? Is Didier still here? No, okay. So, do you know why I've called you up? No. I've called you up because you did the most tweets. Yes. So, would you please give me the bottle? So, you have one bottle for you and one bottle for Didier. So somebody else will. How about Shanfi? Shanfi, are you still here, Shanfi? Yes. Would you come and take the bottle for Didier? Can we ask you to do that? Okay. All right. Yes, you're welcome. So, let me say that this is Shanfi, who can't get out of his seat, but he's also a big tweeter, and you can drink it or give it to Didier, whatever you think is better. Okay. Okay. Thank you. So thank you all for tweeting. So now for Glomago. I'm wondering, I believe there is no representative of Janssen in the room. Is there a Janssen person here? If there is, that person whom I can't see can come down. Oh, it's you. Okay, great. So it's Juliette Renoir qui a présenté hier à Glomago. Donc, je lui ai demandé si elle pouvait juste... I'm sorry, I forgot to speak in English. Okay, so, Juliette, come over here. So for Glomago, she has created with a team an app called Daily So for psoriasis, and she came in as honorable runner-up. So would you please just give us very briefly, what is Deliso?
Hi everybody. Yes, so I'm a digital manager in Johnson, and I work with my marketing team to develop a Deliso application. This application is for psoriasis patients. So we work in close collaboration with the French Patient Association France Psoriasis to develop it because we realized how it was difficult to get real and validated information on the disease. And so we made a survey with 100 patients giving us what they think would be the more important, the key functionalities, and that's how we developed these applications and launch it in the beginning of the year.
Well, thank you very much, and I must say that the questions brought scores that were very close amongst the various finalists. You did very well because the questions were about, do you involve the patients? Do you have a plan for making the app known? Do you have enough investment for the app to continue to be updated? So it was very nice to have you come up here. Congratulations.
Thank you.
So you know that the winner of Lomago is our Spanish team from IVI. So could you just come up so I can officially give you the diploma? I would now like to have on stage the startups from the contest, all of them. And while they're coming down, if one of our Russian friends would like to come down for 1 minute. So all the startups will come down. So I asked you if you could give any thoughts that you had. Like, did the conference impact anything about your own app? So you have created an app on public health for improving prescription quality. Did the conference give you any new ideas?
Yes, we presented an app which helps us to understand what doctors prescribe. And actually, I would like to thank you for this conference, because an importance of the conference like this is one thing. Sometimes very simple, very easy thing, you are missing them. Sometimes there is ideas, you think, why I haven't this idea before? And one of ideas like this, we hope will help us to work with our doctors. We get prescription data from the doctors, we pay them to participate in our surveys, and actually we do it with thousands and thousands of doctors. And one of the core mistakes we found out yesterday on the conference from the audience is that we always missed the idea that we need to explain to doctors how their participation in the surveys could affect healthcare in Russia. And we will definitely change this. We will put this information into all our surveys and test how it will change the landscape of our app. Thank you.
Great. Tell us in Russian the name of your app.
Doctor Index. It's
okay.
actually the same in English.
Doctor Index. So Doctor Index hopefully will be improved thanks to your participation here.
I hope so. It will be improved for sure, and I hope it will bring us more support from our community.
Thank you very much, because he was also in Lomago. So I'm now going to ask each of the startups by reverse alphabetical order to tell about themselves. So Stimula, could you come up here? And then when you finish, stay, okay? So would you, Marc-Antoine Brochel, just give us in 1 minute what is Stimula?
So hi everyone. Basically, you just remember the slide from the cancer presentation that said that 50% of cancer could be avoided thanks to lifestyle modification, lifestyle behaviors. Well, Stimul has been created to help people live free of chronic disease. So we basically design high-touch therapeutic interventions to help people with connected devices, health coaching, so real human health coaching at a distance, and flexibility as well as scientifically proven curriculums. And thanks to this whole ecosystem and platform that is online, people can basically, either at a prevention stage or when they are affected with a disease, will take back some control on some of their behaviors, so at the end of the day, they live free of their disease. Thank you.
Gabrielle from Cite. So we are very fortunate that Gabrielle Escalona was able to come here all the way from Venezuela. Would you give us the 1-minute explanation of Cite?
Hello everyone. Well, Cite is where e-health data meets the power of collaboration. In Latin America, we have 12% of the data that is stored in electronic health records. And the principal issue here is because of the high prices of these tools. And with Cite, we make a cloud-based web and mobile platform from doctors and patients to make an ecosystem where we can store all the data and make big data analysis for impact solutions for health in Latin America.
Okay, thank you very much. So now it's R&A, Simon. So Simon Borgi.
Yes, that's correct. Thank you. So we are RNA, read and analyze. We help doctors to improve visualization of medical images in analogic and digital formats. We want to help the transition of doctors to a technology that helps them actually measure, save, archive by patient, all type of medical supports, images, such as film support, whether you get it in a CD, whether you want to actually digitalize it, send it to your colleague, you want to text messages, you want to have it maybe compatible with DICOM systems as well. So RNA is trying to improve that to make it easier on a day-to-day basis for doctors.
So you have your demo out there.
Yes, we have it at the entrance.
Yeah.
But
you should really go by and see.
I think it's good.
Oh, it's not working anymore?
No, we've
plucked it. You put it away. Out, yes. Well, you can get in touch with them. I think it's a very interesting new tool.
Please don't hesitate to contact us on our website, readandanalyze.com or tactilox.com.
Okay. So next is Sophie Davidas from mHealth. Thank you.
Thank you, Denise.
So what is mHealth?
So if you have been recently through a surgery, you can understand very fast why is mHealth very good, because you remember this terrible feeling when you go home and you have all those questions coming to your head. Is my pain normal? Is it normal that I bleed? Am I going to die, basically? But you don't want to disturb your doctor because he's a very busy man and he doesn't want you to disturb him also. So how do you solve these issues that you both have, the doctors and you, to keep contact but not disturb each other? So the doctors want to be sure that you are okay, but he doesn't want to be disturbed, and you want to be sure that you are okay, and you don't want to disturb your doctor. So this is what mHealth is all about. It's about a platform for doctors to set up follow-up protocols. So through mHealth, you're going to receive new patients, questions, tasks, and information every day about you and your disease. And if there is a need for alerts, then you're going to have an alert coming back to your doctor. And the alerts is set up so that he has to call you back, but only if this is a serious alert. If it's just that you worry, then you will get a message, don't worry, do this, do that, and everything will be okay. So this is exactly what mHealth is about. Thank you.
That's great. That's great. So now I'd like iDoc Chat. So tell us, what is iDoc Chat? It's from Italy.
It's from Italy. So Dr. Chat is an application which facilitated is an application especially for doctors to facilitate the exchange between doctors around the world. So you can ask for advice or you can solve some cases. And on the application you are able to share videos or photos. On the photos you can write what you want. You can exchange by private chat or private chat. And you are able with Dr. Chat to solve some case quickly.
Okay, so to summarize so far, what's really fascinating every year, we get so many applications. I then interview the people through Skype. Everybody gets a Skype interview in English so that everybody is equal. Even if they were living next door to me, it would be a Skype encounter. So we have Doctors Chat. We have a new tool for radiologists and general practitioners to see images better. We have a very science-based behavior-changing platform. If somebody who wants to revolutionize the sharing of information in Latin America, coming from Ecuador and Venezuela, and we have a tool for follow-up of patients after surgery so that a protocol can be put in place. So you see it's all very different things to compare. The jury of, are any jury members still here? Is there anybody from the jury? Miguel, would you like to come down? Yeah. Yes,
the chairman is here, Denise.
Yes, of course, Brandy is here. Yes, Brandy, would you come down?
Yes.
So I just wanted to point out the jury anyway. We had, so Yurian was on the jury and Miguel from Spain and Maria Balash, who's not here, and we also had the representative, Susanna from Bayer. Is she still here? No. Okay. So and Emily Kramer. So this was quite a very jury, and I'm now going to ask you to come up with Be My App. And I did a reverse alphabetical order so that I would end with the winner. So congratulations. So before I ask you, I will say how we know each other, because we met indirectly. You heard about the conference because there's somebody in your family who is a specialist of diabetes, and 2 years ago, I think you were still an engineer weren't you? 2 years ago, you were still an Air Force engineer, when this person, who was a professor of endocrinology, suggested that you attend a meeting where he was speaking. We did a meeting called Diabetes 2.0. I don't know if this was where you started getting your idea, but you might be nice to tell me yes. So is that where you started getting the idea, or was it before?
Yeah, I remember very well. Actually, no. But we just saw a lot of testimonials and speeches, so it was very interesting.